With us what things were like with your mom and how you found this technology and what's improved for her life.
Okay, hi guys. Um, so my mom has a traumatic brain injury and um, just multiple car accidents, head concussions, a lot of head trauma resulting in a brain injury. And she had already come a very long way. She had had to relearn how to walk and talk and speak. So by the time we found this technology, she had a semi-normal life. She still needed a lot of supervision. The main issue is she had a lot of seizures. Her brain would get overstimulated, noise, light, sound. And she got to the point she was having multiple seizures a month. She started having multiple seizures a day in the beginning. We got to the point where it was still a couple times a month. So it was manageable, or so we thought. When we introduced the patches to her, it will be a year next month. So she's been wearing them for 11 months. She, she stopped having seizures. During this whole time, she's only had one, and it was because someone accidentally shined a flashlight into her eyes. And yeah, this has been the busiest year of her life since she had her brain injury. So one of the big reason she would have seizures is, she would get overstimulated and there was no outlet for her brain. She was not sleeping, so she wasn't getting into an REM. Her brain wasn't releasing pressure at night. So it would just, the next day, it would build and build and build until she'd have a seizure. That was her brain's way of relaxing. So the patches got her to start sleeping, which I think is why she hasn't had any of the seizures. She would start recovering at night. Now she does use X39 and Eon, and she uses the sleep patches. She uses two sleep patches on the side of her temples, but it works. And it's just been incredible. She can ride a bike now. Um, and yeah, the sleeping and the no seizures are just huge. And she's actually, another thing I noticed, she had a really hard time reading, keeping up with even looking at the page and the words. She's now taking an astrology course. She is mapping out the planets and yeah, she's overwhelmed and she's challenged, but she's doing it. She's explaining to me my birth chart. And I am gonna cry. It's been such a blessing. Yeah. So that's my mom. And I actually tried the patches before I gave them to her because I, was nervous about introducing something new and wanted to give her reassurances. Um, I noticed the first 3 days I wore the patches, I had mental and emotional clarity. I worked in a stressful job, and those 3 days I was just calm and happy. And I was like, wow, this is great. And I had a chronic cough. I couldn't take a deep breath in cold weather. And back in February, it was probably -9 degrees. And I was taking full deep breaths without noticing any discomfort, any cough, and it has not come back. I've used the X39 and Aeon on my toe to get rid of the arthritis there. It's gone. The pain is gone. Um, yeah, I was limping for about a year, and now I can walk and jump and do all the regular things. And the I can't say enough good things about the patches and the energy patches too. I didn't even realize I was lethargic and all the time until I tried the energy patches just out of curiosity. And I felt like a normal person. I would get headaches at the end of the day just because I thought I was tired or, yeah, did the patches make me feel like a normal person? And I didn't even realize what that was. I was just so used to the suffering that, um, yeah, everything just feels like a blessing now.
That is, I love that you said that you felt like that you didn't realize what your normal had become. And I think that
I have the pleasure of introducing a doctor of chiropractor to us. And we always love hearing from our doctors because they look at this in different ways and believe it or not, Dr. Tony is going to share about his father and what happened, and a little bit about his background. He's coming to us from Texas. So please unmute Dr. Tony and let us know what was happening before, what you were dealing with, how it was compromising your life, his life, what you were going through. I know there was a lot going on. And you just have to, yes, welcome.
Hello, everyone. Can you hear me? Perfect.
Yes.
Okay. I make sure I muted myself. Anyway, I'm Dr. Tony with Chiropractic Associates of Bedford in Bedford, Texas. And my focus is on functional neurology. And it's a specialty in chiropractic. So it's also known as chiropractic neurology. And the new nomenclature is functional neurology. But anyway, I'm here to talk about my dad, give him a testimonial. The condition that my dad has been diagnosed with is vascular dementia. And, taking my dad to see a medical neurologist, which I made friends with, by the way, multiple office visits, and it wore me out. It wore me out. I wasn't working at the time. This all began back in February of 2022. And let me tell you, it was a nightmare. It was a nightmare. Well, at the time, my dad was living with my wife and I noticed one Friday afternoon, my dad's conversation wasn't making any sense. He was saying things like, first of all, he didn't know who I was. He did not even know who I was. He thought I was his brother, Frank, my uncle Frank. He passed away over 10 years ago. Sometimes he thought that I was his cousin, Rokino. He kept mentioning he wanted to visit his aunt, who also passed away many years ago. So he thought he was living in Italy. And, that to me was so frustrating. How do you tell your father you're not in Italy, you're in the United States? You're living in Texas. What are you talking about? He always mentioned wanting to see his mother and father, and they passed away many, many years ago. And you're trying to tell him that they're not living anymore. And there were many times that I would lose my patience with him, getting so frustrated. I don't know what to do. He would repeat the same things over and over and over again. And he became very restless, very restless. And again, it just wore me out. You get tired of hearing the same thing over. And I was like, I'm losing my dad. What is going on here? It was like a awakening here. Like, what am I going to do with this? What am I going to do with this? He'd wake up every morning at 2 a.m. He would change his clothes. He would say, I have to go home now. And I would tell him at 2 o'clock in the morning, where do you think you're going? I tell him, this is your home. You live here. He said, no, I have to go home now. And you're trying to argue with my dad at 2 o'clock in the morning is not easy. You're tired, you're frustrated, you had a long day, and it keeps going on over and over. So he could never sit still, always wanting to leave and say, I have to go home. And that was around 2:30, 7 o'clock every time at that time period. And what I learned, it was called sundowning. Many of you probably heard about this term. It's used when dementia patients or dementia people or Alzheimer's, they experience these type of symptoms throughout the day. So a couple of times he wandered off. And luckily, my wife and I found him. We had to put safety locks on all the doors for him not to walk out and wander off. So after a couple of weeks, I decided to look for ways to help him to get his memory back. I had to really scramble and dig deeper and find ways to get his memory back because I was really losing him. It's like he doesn't know who I am. He doesn't know who my wife is, doesn't know none of us, basically. So the first thing I did is I changed his diet, thinking, well, I'll change him to a ketogenic diet. So I did that. I tried so many supplements that were designed for the brain to improve the memory. So after all that, the supplements didn't quite seem to make a difference. It helped, but it wasn't the same as the patches. The patches are way more. I'm going to tell you right now, I'm going to go into that in a minute here. Way more remarkable improvements that I've seen with that. So back in around June of 2023, I came across Glenda and Don. who introduced me to the Life Wave patches. So I told myself, well, they told me everything, all the information. And so I told myself back then, I said, what do I got to lose? Let me give this a try. So that's when I started using the patches on my dad. Within a few weeks, I noticed again remarkable improvements that I've never seen. I said, I wish I would have had this back in 2022. He recognized me and he called me by my name. That's a huge improvement to me. Just within a few weeks, he knew who I was. And every time I would come home from work, he would say, "Hey, Tony's home. Tony's home." I said, "Wow, look at that." I told my mom, "Look at that." She noticed too. He was more coherent. He had more understanding. He is definitely more calmer now than he ever was. His conversation started to make a little more sense. I had to be careful because he would pick up on things in conversations. I said, "Uh-oh, he's learning. He's picking it up." So I had to be a little more careful. He's beginning to go back to his ways again. It's like, oh, this is good. This is
They
looking really
usually be.
good. Um, he's listening to me more. He doesn't wander off anymore. No more locks on the doors anymore. He isn't constantly saying I have to go home. He started singing church songs, which that blew me away. So he remembers church songs. He never done that before. And he sleeps well. He does not wake up anymore at 2 a.m. in the morning. So from seeing all this improvement, I am consistently putting these patches on him every day. The X39, the X49, carnosine, glutathione, and the Eon. And I thought, okay, this is working remarkable. I can't stop. This is, and I'm about to try it myself as well. So that is my testimonial for my dad. And again, I wish I would have known back in 2022 because I was going through a pure nightmare. You wouldn't believe. So frustrating, tired, exhausted. But now, wow, what a relief. I'm so happy. It is a relief. And again, it blew me away. So
Yeah.
just like that.
Being a caregiver of someone at that level, and all of a sudden it just started and you were like, caught off guard and it just went downhill. So, yourself, a big emotional upheaval, but I mean, bringing your dad back like this, having something that's so simple, the putting the patch on and off. And I know, wasn't there 1 week that you had stopped and you noticed a difference? Do I remember that right?
Yeah, there was 1 week that I didn't put it on him, but as soon as I put it back on him, to me, it's like the improvements. I didn't want to stop. I had to keep putting the patches on. I got up early in the morning before I would go to work and I put the patches on while he was sleeping. So that way he wakes up, it's already on. Then at night when he go to bed, I take the patches off. So I thought this is great. I can't stop, and so till this day on, I said, this is really wonderful and it's amazing. And I noticed too, one thing, his skin, he's looking younger again. I said, well, I wasn't looking for that. I was looking for his memory, getting his memory back, getting my dad back, But again, even his skin was changing to looking younger, like he looks like he's 20 years younger. So this is really good. So
Yeah, I know. This is one of the great side benefits of activating the GHK, which Leah will tell you about, because all the collagen starts building. So there's so many multiple benefits, and we know that your dad's going to continue to get better and better. And I want to hear your results. You've got to come back now, and we want to hear from you. And hopefully you're going to be putting it through with your patients. So we'll bring you back in another few months to get an update.
absolutely. And I think somebody asked how old is my dad? He's 84 years old. And he looks like he's in his like late 60s now with those patches.
Wow.
And so this has been just 8 months on the patches, right?
Pretty much, yes, about 8 months. Yeah. Yeah.
Great. Thank you, Dr. Tony,
You're
so much.
welcome. You're welcome.
Okay, Leah, take it away. Tell us how this product patch works.
Well, I would love to. This is one of my favorite things to talk about, you guys. You know, when we talk about this patch, I've taken off half of the sticker. So you can see this side is smooth, this side is sticky. And when we think of typically a patch, you guys, this is a wearable light therapy non-transdermal patch. Now, typically when we think of a patch, we might think of maybe a nicotine patch or an estrogen patch or a pain patch where there's actually a chemical or a tincture or a substance on the patch that's going to transfer this through the skin and get into the system that way. That's not what we have, you guys. This, if you look in the middle, there's a little white piece of fabric. It's sandwiched between two polymer shells, hyperallergenic polymer shells. And what's embedded in the middle of that little piece of fabric is what we want to share with you. Beamy had mentioned David Schmidt, our owner, the inventor, the founder of this technology over 20 years ago, you guys. This company is a 20-year-old company. But what David discovered and what he has embedded in that little piece of fabric, you guys, it's a compound solution of organic amino acids, sugars, oxygen. It's a molecular structure that forms a crystal lattice, and it becomes reflective. So now what happens when we put this on our body emits a low-level infrared light. If you've ever gotten to look through night vision goggles, you'll see all the colors radiating off of the body. There's a very specific wavelength of that light that reflects a signal off this patch back into our body, and it's a very specific biophotonic exchange of information that happens on a cellular level, and it causes our body to activate and elevate a copper peptide that our body makes called GHKCU. And this copper peptide, you guys, was discovered over 53 years ago by Dr. Lauren Picard. And Dr. Picard has over 5,000 studies on GHKCU copper peptides when he discovered this peptide in the human body. And he actually coined the term, or GHK did, fountain of youth, because GHK has incredible benefits for our skin. Dr. Tony talked about how quickly he saw a change in his dad's skin. It's because of that GHK, and our skin is the largest organ. Some of the studies showed incredible improvement in the neurological system. Again, Dr. Tony's dad showed such improvement neurologically because of that GHK, in addition to some other cells in the body. But another thing it's really big in, you guys, is the vascular system. So GHK copper peptide, as you can imagine, supports so many things in the body. One of the things that it controls, you guys, is our body's stem cell production. And what happens as we age, you guys, we lose our GHK copper peptide production, therefore losing our stem cell activity in our body. And you may ask, well, why are stem cells important? Stem cells are important because they are the only cell in the human body that can morph into any tissue, any cell, any organ, anything that needs to be repaired. And we call those pluripotent stem cells. The egg and the sperm come together, create a stem cell, and from that stem cell, all stem cells are created, and the organs are built, and everything is just intricately designed in the body. So we know the human body was designed to heal and repair itself. But as we age, that aging process, which a lot of people don't tell us exactly what that is the loss of our stem cells as we age and their ability to heal and repair our body. And by age 35, we have only 50% of our body's own stem cells still present and active in the blood, trying to heal and repair our body. And, Mariah talked about her mom. You guys, sleep is so important. We're going to wear this patch for 12 hours and then we're going to take it off. You heard Dr. Tony say he was sticking them on when his dad would wake up in the morning or before he would wake up, and then take them off at night. Sleep is crucial for the brain to heal and repair, for the human body to heal and repair. And then, you guys, by age 60, 65, which a lot of us are pushing here, there's less than 10%. You've got about 8 to 10% of your stem cells still traveling through your blood trying to heal and repair. So you can see what that aging process looks like now and why the aging process is happening. It's because we're losing our stem cell activity. That's plain and simple. So here we're going to activate and elevate for 12 hours a day. You remember I told you it's non-transdermal. There's nothing going into the body. Therefore, there's zero side effects, zero contraindications with medications, supplementations, anything that you may currently be doing. But we do want you to consult your doctors or your practitioners, because if you are on medications, we do see a lot of people starting to come off of medications, which should be a goal. Medications are not, they're foreign to the body. The body can heal itself, right? So 12 hours on, 12 hours off. The only thing you have to do, you guys, is you've got to drink water. I talk to people every day, and water is such a big issue for them. And the number one reason is because they don't want to pee all day. But that's getting the toxins out of the body. We've got to get better out than in. That's what we like to say. So our rule of thumb is half your body weight in ounces daily. I know it's daunting for some people, but it's so important to keep your cells hydrated while you're wearing this technology. They need that conductivity to communicate with each other. If they're not hydrated, if you've got some cells that look like little raisins, they can't communicate. You're going to have systems break down in the body. So water is super important when you're wearing this technology. You know, another question that people ask is, how long do we have to patch? Well, we want to say rule of thumb is 1 month for every decade of life. Kind of gauge that as a starting point, right? We want to wear that patch 12 hours a day, take it off at night, and do that day after day, week after week, month after month. Because what we're seeing in our clinical studies, and a great website that David, I'm sure maybe he's already put it in the chat, startx39now.com. That's where you can access our 90 clinical studies done from third-party institutions, independent doctors around the globe. LifeWave is available in 83 countries, you guys. And like I said, it's a 20-year-old company. Beamy, I'm going to toss it back over to you. Do you want to share a little bit of history on the company in our last few minutes? Because I think that's super important to tell how this company started.
Yes, I would love to do that. Thank you. That was a great overview of the science. Love that. So this company is really rocking, guys. We have over 94 patents. The company started in 2004, so this is the 20th year, and we are rock solid, but we have the excitement of new products. Because David Schmidt is a lab rat, and he is in the lab all the time, inventing R&D, coming up with new technologies to help us live a more resilient, more vibrant life. And really, LifeWave is a biotech company. And what happens with that is David is in research 5 years, a 5-year plan, a 10-year plan. So we have new patented, unparalleled products on the board coming out. And a matter of fact, this year, we have 3 new products launching, one of which has just launched. And the person that invited you will be glad to share that with you. And because the company is so dynamic with coming out with new technology, the whole company is like buzzing because we have a patent. We have something nobody else has in the world. And that is significant because there's billions of dollars being thrown into this industry of regenerative science. Nobody can touch the patch. And we have a 20-year patent on that. So when the company about 5 years ago, before the X39, it was doing okay. It was about at $30 million a year. Now the company has more than 10 times its revenue growth, and it's over 400 million a year. And that is because of the launch of the X39 and a couple other products that have come out. So the company is in mass momentum. And guess what? 60% of the revenue comes back in commissions for the field. And we have 5 offices worldwide. US, Taiwan, Japan, the new one in Korea, and Ireland. And like Leah said, we're in over 83 countries. So with all the amazing results that you heard tonight, and we'll continue to hear, because every night we do these testimonials, stories. We have 2 new people coming on. You may want to put on your business hat and consider this huge opportunity with a company that, like I said, is in full momentum, because being stable and well established, but having the excitement of new product exclusivity is a win-win situation. So I want you to ask yourself, who do you know that is struggling with some kind of health condition? Who do you know? Pretty much a lot of people, a lot of your friends and family. And who do you know that wants more energy and to relieve pain? So if people come to mind, you can help them. This is why we're so passionate, because the stories like you heard tonight, and we hear these day after day, we have a solution for people that is easy and doesn't interfere with other things going on in their life. So think about who you can help, and why not help people by referring them to this product, and you can make some extra income to cover the cost of your product, and who couldn't use extra revenue, right? So how do you get involved? You can talk to the person that invited you. We have different wholesale packages. It starts at $125 and goes up to $1,600. And along the way, you get different perks and different pricing depending on what you're going to purchase. But really think to yourself about who you can help, because this is the essence of this company. We want to patch everybody because we know that the body can heal itself when it's given the right communication. We want to be clear that the patch is not healing. The patch is waking up the body to go into the healing mechanism, activating the GHK, activating the stem cells so that the body can heal itself. So join us tomorrow night, and we'll have 2 more great testimonials. Thank you so much for being here with us tonight.